Hello, I'm Dr. Jeff Smith. We're here to talk about knee pain today. I'm the author of this book, Living Pain Free, It's Your Choice. I'm a board certified chiropractic physician. I have certifications in meridian therapy and a degree in human biology. We practice neurological and metabolic care for the chronic patient. We're here to talk about knee problems. There is a significant increase in knee problems over the last 10 to 15 years. In fact, 15 years ago, there were over 17,000 knee injuries in high schoolers alone. That has increased to today's standards to about $650 million a year in knee problems. We're going to talk to you today about a revolutionary new treatment. It's non-surgical, it's non-pill, it's non-shot, it's non-injection, it's no cutting, and it's absolutely painless. We're here to talk about laser therapy for the knee. We're going to go through how we can increase your range of motion, decrease your pain by as much as 82% almost within the first few weeks of therapy, how we can restore mobility, how we can restore the usefulness of it. For those of you that golf and enjoy golfing and the knee problem is not allowing you to bend and move because of limited ranges of motion, we can change those things naturally for you. So for the next 15 minutes or so while you watch this video, I want you to pay close attention to all the different things that are out there and all the different new technologies that are available today. I'm Dr. Jeff Smith. I look forward to teaching you, and I look forward to seeing you in the clinic. All right, so here's an example of a normal knee, textbook normal knee. We have our tibial bone, fibula down here. You can see a faint shadow of the kneecap here, but what's important is this shadow right in the middle. This is the joint space where the cartilage is. If we compare this knee to this picture here, the one striking difference is we've lost that shadow right over here in this area. That shadow represents where the cartilage should be. The cartilage is the cushion for the knee. You can see there's plenty of shadow or plenty of cartilage here, but if you look on this side, there's almost none. And in fact, if you look really close on this side, you can see some of the bone spurrings. Here's another example of a knee space or the cartilage that we've zoomed in on. You can see how far apart the two bones are. That spacing is key to providing cushion for the knee. As you can see, there's a little bit of an arthritic spur or possibly a cyst developing right over here, but this patient did not have any knee pain because we had plenty of space between the cartilage and the bone. In this x-ray, you can see again how we've just lost that space. This is a total outside collapse of the knee space. The patient has no pain on the outside of the knee, but on the inside portion of the knee, there's tons of pain because there is no space left in here whatsoever. In fact, that's what we would call a bone-on-bone x-ray. Now in this picture, this is actually not a picture of a knee. If it was, it would be the funniest looking picture we've ever seen of a knee. This is a picture of a lower back. In fact, this is an MRI. The reason we want to look at the lower back is because we're looking at these shadows, these dark spaces in between the bones. Each one of these gray squares is a lower backbone. Here's the third one and the fourth one. The spacing is actually the cartilage between the bones, very much like the cartilage in our knees. Now, why in the world would we be looking at a back picture for a knee patient? Well, here's why. This white material is the spinal cord. That spinal cord produces nerves that run right down the legs. And you guessed it, they run right into the knees. When these bones compress together, they bulge out the cushion between them, the cartilage between them. That's called a bulging or a herniated disc. And if you look closely here, and here, you can see the black bulges that are coming into and touching the white material. Well, if that's occurring, where do you think the pain will be shooting? That's correct. It's going to shoot right down from your back into your hip, right straight to your knees. And this is one of the primary causes of knee problems that we see in our clinic. And finally, in this picture here, this is an x-ray of a lower back. I wanted to show you this to give you an example of how some of the wrong decisions can result in the worst knee pain of your life. As you can see, these are two pictures of a spine. These are lower back pictures. This is a lower back picture from the side. This is a lower back picture from the front. You might ask yourself, what is this white, strong white material that looks like nuts and bolts or screws that are going into that spine? Well, that's exactly what it is. This is a picture of what a lower back surgery looks like. This patient went through surgery for back pain and knee pain and leg pain. And this is one of the most interesting things that we've seen, because these bolts and screws go so deep into the spine that it can create almost an impossible ability to heal. So the patient that's had these procedures done, 95% of the time are in the same amount of pain 2 years later that they were in the day they had it done. Alright, in this picture we have a description of a back pain patient that experiences knee pain along with their problem. This is a picture of a person from behind. These yellow lines represent something that should be very familiar to the knee pain patient. These are your sciatic nerves, and these nerves come right off the lower back. When we have pain and problems that develop in our lower back, we experience pain down one leg or the other. So if I have a problem here, for instance, if I simply follow this yellow line down to find out where the pain will go, guess where it goes? Into the knee. Now there's different nerves in the knee. There's the obturator nerve, the lateral cutaneous nerve, the medial cutaneous nerve, the tibial nerve, and the posterior femoral nerve. All of those nerves control the muscles of the knee, and they give the stability to the knee. A patient that has problems in their back where these nerves become affected, they absolutely lose strength and stability in their knee, and that is the primary cause of knee destruction in most of our patients. So just after I showed you where those nerves go, now I'm going to show you the knees themselves. These knees are protected by all of the muscles of the quads. We have muscles on the top of the knee, the side of the knee, the inside of the knee, and underneath the knee. These muscles right in this area deliver all of the strength and stability to the knee. If you do not have strength and stability in the muscles, your knee will absolutely begin to fall apart. So in the next segment of this video, we're going to show you, and I'm going to have my doctor help me with this, we're going to show you how to test for these things. And these are examples of tests that we will do with you as a patient in our clinic. Alright, I've got Dr. Rowden here. We're going to use his knee as an example for this. Now, in the testing that we do when we have our patients come into our clinic, we're going to test these muscles that run along here, because these muscles are the strength and stability of this knee. If these muscles are damaged, this knee will be damaged and it will not work. The nerves that control these muscles come from the back and come right down through here, but it's the muscles that'll be sensitive. And you can actually test these things at home yourself. We'll test them on you when you come in for your examination, but you'll see for yourself how painful it can be. Now there's 5 muscles we want to test. The first one is right inside the knee, so we'll take the patient's knee, we'll just slightly bend it, and we'll put a little pressure right in here. That muscle controls the inside stability of this knee. If that muscle is painful, that means you'll have no strength to hold the inside of the knee. The next muscle is a long muscle that runs right along here, and it comes right across the top of the knee. Lifting the knee up and working it just like this will expose that muscle, and if you put a little pressure right there, it should be painful. Now luckily Dr. Rowden doesn't have a knee problem, but we can still use his muscles as an example. Now on the back side of the knee, what might actually be a little easier to show you is on this side. This outside portion of the knee, if you bring the leg up like that and push in, that muscle will be very tender too. And then on the outside edge, there's a long muscle that runs called the tensor fasciae latae muscle. And this muscle will be sensitive right over in this area here. The final thing we want to check is a muscle right up underneath the kneecap. This popliteal area of the knee can be very painful sometimes. So if you just reach behind and put a little pressure there, if you have a significant knee problem, you will have significant pain. So let's talk for a minute about what are the causes of knee pain. Now, the obvious cause to knee pain for a lot of people is just trauma. Now, trauma can happen in the form of an injury, a sporting injury, a golfing injury, a fall. But what tends to be the case a lot of the time is people get injured years and years ago, and it finally catches up to them and their knee starts suddenly hurting. So when they come in to see us, we ask them, well, what caused this problem? The typical answer is, I don't know. They don't know because the cause was something that happened 3 years ago. They maybe fell down, bumped their knee, it hurt for a few days, we take some pain pills or some anti-inflammatories and we get over the pain. Body's really good at adapting to pain. The problem is the damage to the knee is still there, okay? So over a period of a few years, the knee starts to turn arthritic, it starts to develop bone spurs, the space starts to collapse, the cartilage disintegrates, and lo and behold, we get up one day and our knee doesn't move as well as it should. So the typical answer is, I don't know what causes it. Now, there are other things than trauma that we look for in terms of knee pain. The back, for instance, is a primary source of knee pain because the nerve that comes from the back goes right to the knee, okay? Another thing, and this may surprise some of you, is blood sugar levels. Blood sugar can very much aggravate nerve tissue. All of our nerves are surrounded by a coating called a myelin sheath, very much like the power cord to your lawnmower. If that power cord does not have that rubber protecting of it, that nerve or power cord can become very damaged. Much like a nerve, our nerves are coated with a coating called a myelin sheath. High levels of blood sugar destroy that coating and expose the inner nerve. So if you took a power cord that's plugged into something and you chipped off some of the rubber coating and exposed that inner wire, that could be pretty bad. The same thing happens with high levels of blood sugar. Another thing that can be a big problem for knee pain patients is being anemic. When you're anemic, we don't have enough good blood supply, so we don't have enough oxygen in our blood to heal things. And when we have destructive knee problem or damage to our knee, our body can't heal it because we're anemic and we cannot get enough oxygen to the area. Those are things that can cause very, very bad problems over a long period of time, and typically those aren't things the doctor even touches upon. Well, in this clinic, we practice functional medicine, which means we have to deal with every aspect, not only what's physically wrong with the knee, but what's neurologically wrong and what could be metabolically causing problems as well. And that's what makes our clinic different, and that's why we have such a very high success rate with our patients. Now, briefly before we talk about what different types of therapies we do for our knee patients, I want to talk just a little bit about some of the pain itself. One of the biggest things that we find is when we want to eliminate pain to the knee, we want to stimulate a part of the nerve channel called the large diameter afferents. Large diameter afferent nerves fire into the part of the brain called the lamina 2. The lamina 2 is located within the spinal cord, which is when we do a neurological evaluation of our patients, we have to check the spine as well as the nerves as well as the knee, because LDAs, or large diameter afferents, when they fire, they decrease pain. So we want to see how we can stimulate their firing. Alright, one of the first treatments we do is called EWOT therapy. Now, EWOT therapy stands for exercise with oxygen therapy. Oxygen is one of the key factors in healing damaged joints and pain. Okay? As we age, our ability to utilize oxygen itself decreases by 1% every year after the age of 25. So if you're 75 years old, your body's ability to use oxygen has decreased by 50%. That means your ability to heal by 50% is less. Now, we do exercise with oxygen therapy with our hands. Our patients breathe oxygen through a tube in their nose, and we just have their hands go very slowly like this on a little bicycle wheel. Now, you might ask, why in the world am I moving my hands if my problem is my knee? Well, we want to increase the oxygen capacity of the bloodstream so we can help get more oxygen to your knee to help it heal. We do that by stimulating the brain. By moving my arms like this, we're stimulating what's called the cuniculocellular tract of the brain. That tract of the brain fires much faster than the spinocerebellar tract, and the spinocerebellar tract is actually located in your legs. So we want to increase that as fast as we can, so to do that we use the arms instead of the legs. Alright, this is an example of the EWOT therapy we talked about earlier, or exercise with oxygen therapy. Dr. Rowden is breathing oxygen through his nose. We have a tube connected there, and it's connected to a machine that produces oxygen. This machine compresses it and increases the flow of oxygen into your system. By doing this activity, he is firing the nerves of his brain that will stimulate healing and growth to the knees. So we're going to talk about a couple more things that we do. One of them is called vibration therapy. Now, why in the world do we do vibration therapy? Well, vibration stimulates the LDAs, or the large diameter afferents. These are the nerves that cause a decrease in pain. They reduce your pain. So by utilizing vibration therapy, we can actually reduce pain in the knee, in the back, in the legs, or wherever it is. And it's a very simple treatment. You just stand on a platform and it simply vibrates very gently. Okay, we do that for about 5 minutes or so. Our pain levels go down dramatically. The next thing we do is something called PNRT, or peripheral neuropathy rehab therapy. We call it Rebuilder. Okay, we use a machine that runs at about 7.83 hertz. This is an electronic device that the patient actually holds in their hand and utilizes. What it does is it sends a very gentle stimulation through the feet up into the knee, and it helps stimulate growth of the nerves. It helps to fire the LDAs, which reduces pain, and it helps to heal the problem. Now what Dr. Rowden is doing is, this is called vibration therapy. I spoke about this earlier. This platform is very gently wobbling back and forth. What this does for the knee pain patient is it increases stimulation to the knee joint. It strengthens the muscles, it reduces pain, and it fires those LDAs, or those large diameter afferents, that help reduce your pain. This is a very simple but very effective way to help eliminate knee pain. Okay, so now we're going to demonstrate the Rebuilder. The Rebuilder works like this. It's a single handheld device. The patient gets to hold it themselves, and there's a little dial on the top that they get to turn. This kind of dictates how much electrical impulse we're going to put into the nerves of the knee and the legs. This is a foot bath, and what this does, this is filled with a warm saltwater solution. This warm saltwater solution will conduct the energy from this box into the nerves of the feet. That energy will travel up the nerves of the legs into the nerves near the knee that we talked about that are damaged, and it will help to treat the knee. The Rebuilder helps to literally rebuild dead and or damaged nerve tissues in the knees. This technology is very new and very, very effective in not only reducing pain, but stimulating new growth, reducing inflammation, reducing swelling, and helping to heal the overall knee. Now, one of the other big therapies we use, and this is one of the primary treatments that we do for knee pains, we use laser therapy. Laser therapy is very much what it says. It is a light, a very powerful light that can penetrate deep into the joint. Laser light therapy has a lot of benefits that you cannot gain through a pill or shot or a surgery. Number one, it causes accelerated cell reproduction and growth. So when the knee becomes arthritic and damaged and is just falling apart, the laser can stimulate healing. It also stimulates faster wound healing. The laser stimulates fibroblast development, which helps develop muscle and bone and cartilage and tissues you can't develop anywhere else. Now, lasers also increase metabolic activity. What is metabolic activity? Well, that is the body's ability to utilize oxygen and nutrition and sugars to create things, to function, to perform. And then it reduces fibrous tissue inflammation. What happens a lot of times in knee cases is we get very bad arthritic deterioration where there's fibrous material forms very strong bonds, and those bonds can be very much like bone. You might have heard the term bone spur. That's very similar to what this does. Laser therapy reduces the formation of these things. It reduces inflammation, it reduces pain, it stimulates healing, and it stimulates growth of cartilage. Those are things you can't get with pills. All right, what we're showing here is the actual laser head itself. Now Dr. Rowden is helping me out here with this. That red light, as you can see, is absolutely 100% painless. You will not feel a thing when we do this. But those 4 muscles, or those 5 muscles that we told you about, and the pain points in the knee are what we will stimulate with this laser itself. It will penetrate right through clothing, right through the skin, and go to the heart of the problem. It's a very quick procedure. It only takes a few minutes, and it is absolutely 100% pain-free. And finally, the last thing I want to talk about before we demonstrate this is the back itself. These little yellow lines, these are the little nerves that come off the backbones and run down our hips and down our legs and go straight to our knees. And our bones are supposed to be separated. When our bones get smashed together and that cartilage between the lower backbones gets compressed, it pinches these nerves. Guess where these nerves run? They run straight to the knee. So one of the best ways to eliminate pain in the knee is to stretch or open that little space in the lower back. There's only one way to do that, and that's called decompression therapy. And we're going to talk about that in just a few minutes. All right, this is an example of lumbar or low back decompression therapy. Now, the purpose of this therapy, and I want to thank Dr. Rowden for helping us with this, is to stretch the lower back. As I talked about before, when the lower back bones get smashed together, we want to stretch them apart to relieve pressure on the nerve. This machine very gently and very slowly pulls the lower back or the lower half of the body this way, and it opens up these spaces and it relieves pain not only in the back and the legs, but primarily to the knee. So this is one of the most important therapies for our knee pain patients. I want to read you a testimonial from one of our patients. After we help our patients, we always ask for them to write us a testimonial to be able to share with other patients. This is one of our patients named Rachel. Rachel had knee pain for many, many years, and she liked to golf and do things that she wasn't able to do very much anymore. She writes in here that it blows my mind to think that what the doctor has done for me in just 3 knee pain treatments has been amazing. Now I want to give you a little piece here. For every year over the age 60 you are, it can take about an extra treatment to feel a little bit of relief. So if you're 65, it takes about 6 treatments to feel better. If you're 70, it takes about 7. If you're 80, it takes about 8 to start feeling better. Rachel is in her 70s. She felt almost complete relief within 3 sessions. Now that's a little unusual obviously, but that's how powerful the treatment can be. 1 month of standard physical therapy and medical care and 3 months of rehabilitation under medical care resulted in no pain relief for her whatsoever. She couldn't get in and out of the car, she writes. She couldn't walk upstairs. That might sound familiar to some of you. She also couldn't get up from a chair very easily, and she had lost strength in her knees. She writes that she is now doing all of those things and more because of our knee therapy program. She writes, reading and acting on a newspaper flyer, which is very similar to what probably brought you into our clinic, regarding knee pain assures her that she will have complete mobility back and have relief for the rest of her life. Rachel, thank you for sharing your testimonial. I want to say thank you for listening to this video and getting a little bit more educated about the knee process itself and what it is we do. These types of therapies are so impactful for our patients. We get their lives back for them. They get back to playing golf, to taking care of their family members, to being able to simply walk and go shopping at Walmart. In fact, statistically, about 82% of our patients experience significant pain relief within the first few sessions. So what we typically do is when we're evaluating one of our patients to see if they're a good candidate for our program is We'll do 2 free sessions on you. We'll let you experience this process for yourself. And you may have already had a session earlier today if you're watching this video now. This will help you determine if this is the right type of therapy for you. So if you're looking for a non-surgical, non-cutting, non-injectable, and non-medication or pain pill related approach, this is the place to be.